Right, now for our speakers, well, I'm a big fan of late night show, and so my inner Kimmel or Jay Leno will come out, but I know he just retired. So when we were planning for our grand opening, we were thinking of having a blessing, but we thought that having a blessing or having a religious group here could be controversial, so what we did instead is to invite politicians. Where's my drum roll?
Never.
Thank you. So thank you for putting your political careers on the line here with us. Thank you. And also for medical doctors in that regard, thank you for being here. But in all seriousness, we are very appreciative of you being here. And I know this is a very busy time of the year for you guys, and again, we're very thankful that you are here. Okay, so for our first speaker, Delegate Guzzone represents District 13 here in Howard County, and he announced his intention to run for Maryland State Senate on the same district. I believe that you are good with just a couple of minutes, but I think some of the speakers are not here yet. Feel free to.
Good morning, everybody.
Good morning.
First thing I got to do is thank you for bringing back lots of memories for me. Actually, because of the School of Rock. I was in a garage band when I was, well, back then. Never amounted to much, but some of the guys in our band actually did. And matter of fact, one of them actually toured throughout Europe and opened for a lot of big bands all throughout Europe about 10, 15 years ago. So keep it up. You guys sounded great. One of the best things that I know that Frank and Alan and I get to do is to come to openings like this. And because it's particularly great when it's a place like this where clearly it just came up organically through a family or a couple families. And the beauty of what you have done and are doing right now is expressing a courage to jump out there, to leap out and to start this business, to invest in yourself, invest in each other, invest in the community, and I know that we're all grateful for that because it takes special folks to do that. The commitment that you're showing to that whole picture, and in an industry that is really important because health and our well-being is near and dear to every one of us. And in today's society, with as much stress as there is, I firmly believe that it's a lot of that stress that ending up causing our physical ailments and aches and pains. As a matter of fact, I don't know which time, but I got a little thing going back here. We may want to work on one later, I don't know. But I'm just so pleased to be here to welcome you and really to encourage you and wish you all the best in future success. So congratulations.
Thank you, Delegate Guzzone. Yes, you know where we are. All right, great. For our second speaker, Dr. Clarence Lamb is a preventive medicine physician at the Johns Hopkins Bloomberg School of Public Health, where he serves as the Assistant Program Director of the Preventive Medicine Residency Program. He serves on the Board of Directors of Healthy Howard, is on the legislative staff of the only physician in the Maryland General Assembly, and is also a candidate for state delegate in Howard and Baltimore County. So, shall we welcome Dr.
So I'll avoid the mic also, just to keep it a little more personalized. I know this is one of the themes that you have for your clinic here. So it's wonderful to see everyone here. Thank you, Roel and Carl and Day and everyone else here at the clinic for opening this up. I think small businesses, particularly here in Howard County, are important for all of us, and for all of you to make the leap in starting this endeavor. It's really a wonderful thing for our community. As a board member of Healthy Howard, we know that it's important to have local healthcare access here, and that a lot of folks don't want to have to travel up to Baltimore or further down to DC. And it's important to have good local providers here offering personalized medicine, preventive care. As a physician, as a preventive medicine physician, that's something that's near and dear to my heart. So thank you again for opening this up here in Columbia, right in the heart of really what has, probably a lot of need for, given our aging population here in Howard County and in the state. This is of particular importance to a lot of folks, and so having good access and good proximity to our community is important. So as a physician, physical therapy is a key part of our healthcare team, and we want to thank you for recognizing the need for prevention here. Towards some of the stations back here, and saw a lot of things that are near and dear to me as a physician, whether that's fall prevention, which you do assessments on here, gait therapy, posture therapy, home evaluations. Those are all important and a good part of what we can do to help keep people healthy. So, my personal story is that I actually had back issues just a couple months ago, that maybe from knocking too many doors, but even at my age, I was surprised by some of the symptoms that I had, and actually did see someone who was dually trained in, and one of his certifications was in physical therapy. And I received a lot of good advice, so I'm sure that you'll probably do so too here. I've worked with Roel before, and has a very committed and dedicated team. For me personally, what I found, this is my free medical tidbit for the day, is that, even as an adult, you hear that a lot of kids should be sleeping on their backs to avoid sudden infant death syndrome SIDS. Actually, for adults, that helps a lot too. So a lot of us end up sleeping on our sides or sleeping on our front side. That torques your back apparently, and creates a lot of tension in your muscles. So when you wake up and you're sometimes feeling sore and achy back there, it leads to downhill for the rest of the day with some of the back issues that many of us might face. You might actually find it better to sleep on your back, and I'm sure that's something that Roel and the rest of his team is aware of here. So free medical advice of the day. Hopefully a good way to start off your day for the rest of the weekend. It's a beautiful weekend. Thank you again for hosting this. All the best in this wonderful endeavor for all of you, and for everyone for coming out here and celebrating this grand opening this morning. So thank you.
So you will wake me up if you catch hold of them.
Yes.
Thank you. All right. For our next speaker, Delegate Turner has served 20 years as state delegate. He currently serves as vice chairman of the House Ways and Means Committee. So let's welcome Delegate.
Thank you very much for inviting me. It's when I walk through the door, I automatically start feeling better. So, it's so amazing to hear two other speakers say they have back pains. So I can't even say I have back pains and problems with sciatic nerves and all those other things. But I have had them in the past, and if you've ever had a problem with your sciatic nerve, you will not forget, okay, ever. But, it's really good to be here today because, physical therapy, your location is really great. I mean, the two locations I've been to for physical therapists have been on the west side of Columbia and now at the city. So I think this is a great location, and I don't know of, there may be, but I really don't know of any other therapists in this area, in this general area. And this, this serves a population of Owen Brown and Oakland Mills and Longreach and Kinch Contrivance, and I think it's a great idea, a great location, and I think you'll have a very bright future. I've had a couple of businesses, and I know how difficult it is when you make that decision to go into business, and there are all kinds of avenues that you have to go down and hurdles you have to jump, and then you come to a point where you're opening your doors and you see people like this, like the number of people that we have here today come and celebrate with you. What I can say is best of luck, good luck, and I wish you the best, and the next time I have a problem, I won't have to go all the way to West Columbia now, or to Ellicott City. I have to be somewhere else at 10:30, so I hope you'll understand that I don't have to leave right now. But thank you very much for inviting me. Good luck to you. Good luck to all of all of the owners, thank you for bringing this great business, great health service to Howard County and to this part of the world. Thank you.
Thank you. I don't know if we could go ahead and bill if you start walking in and you start feeling better. I don't know if we could bill that from insurance. But
What's your ID code?
Yes, exactly. All right, for our fourth speaker, Democrats, please be nice to this gentleman. Senator Alan Kittleman won election to the Senate in his own right in 2006 and 2010 and became minority leader in 2008. He continues to advocate for legislation to improve the business climate in Maryland and protect civil liberties. He's now running for county executive in Howard County. So,
thank you very much. Thank you. Before I say anything else, I know that you announced the guys running for state senate. I wish him well, and Clarence for delegate. Delegate Turner's running for re-election. I want to make sure people know that as well, because he certainly has served Howard County well. I just want to congratulate you and everybody else. It's a hopeful thing when you see people willing to take this leap, and it makes us know that there are people who are optimistic about the future of Maryland, the future of Howard County. And as I've talked, I think it was Carl and I talked earlier, any of us with young children, or children of sports age, I know Guy has tennis players, and my children play a lot of basketball. We've been to the physical therapy many too often, with back issues more than anything else, some knees and ankles as well. I was going to say I have a problem, mine is more upper here, Guy, not down here. But so I've already talked about maybe coming in here myself. But you're right, I think Frank was right too about location. It's really important. The places that I know about are on the west side in Ellicott City, so I think this is a great place for you. But I also just want to thank you for being willing to also work so much with the aging community. I know that you've really made an effort to make sure that you can go out and serve people outside of the office, which I think is important too. I know you've done that in the past, but now you have a place where people can come to, but also you're willing to go to where they are. And that's really important to have that kind of service. And Clarence talked about access to care, and that's just really the big part of everything, is to make sure that people have the opportunity. And if there's anything that I'm sure all of us, if there's anything we can do to help you, we would love to do that. And I wish you all the best. I know you'll be very successful, because I can see already just from the people here that you have the desire and the passion to serve. And when you have that passion and you have that perseverance, which I can tell, you're going to be successful. So congratulations.
thank you. And speaking of aging community, I know we have Congress member coming here in this room. How are you? All right. Okay, so let's go ahead and move on. For the next speaker, Casey Young spends his time working in the senior segment of our population. He strives to find solutions to the medical challenges faced by an aging population, as already mentioned. Casey has a nursing background with work in home health and hospice services. He currently manages a home-based visiting physician company in the Mid-Atlantic region. So let's welcome Mr. Casey.
I am completely impressed with the work that Nina and Roel and Day have done. Thank you again for your invitation, and thank you for everyone for showing up. I was enjoying the music earlier, so Guy and I were talking about that over here in the corner. I was not brave enough to try to learn to play an instrument earlier, and then he started telling me about his garage band days, and his friends made it, and well, he's here with us. So he's made it as well, but congrats to all the players out back. That was awesome, and I hope to hear more. I happen to have the privilege of knowing Nina and Day for quite a while now. As Roel happened to mention, I work in home health and hospice, and now I work in primary care delivery to patients that are homebound in their home. So we're always looking for ways to access community resources that help patients in their homes age in place, to help people recover from surgeries, from illnesses. And knowing Nina and her commitment, and Day and their commitment of going out to see patients in their homes, and then opening up this facility here, because there's some differences in Medicare, Part A, Part B. There's some nuances with that that's sometimes hard to navigate. Now they're serving both. And when they told me about their idea a couple years ago, I was like, wow, that's a big idea. they've got a lot of guts to open something like this. They've got more guts than I do, because I couldn't open something like this on my own or take that step, because that's scary. They saw it. I remember when I first met Nina, and you guys, everyone here knows about relationships when you meet someone. If you meet someone and you're like, hi, my name's Casey, and you're like, okay, he's Casey, whatever. But sometimes when you meet people, you know, you get a feeling like, this person's compassionate. This person is committed. Then I met Roel. Same thing, passionate, committed. When they had this idea, they came to my office and we're talking for a little bit, and they're throwing some ideas back and forth. And I remember I asked Roel, I was like, all right, you've got 10 seconds. We're in an elevator. Tell me exactly everything you do and that you want to do within 10 seconds and convince me of it. And he looked at me and he's like, I'll get back to you on that. But he's done excellent. Look at everyone that he's invited here. I mean, we have state delegates and senators and physicians and the whole team and community resources. Look at everyone who's here. So for me, from my perspective, I've been able to see this evolve. I've been able to experience the compassion and the commitment to patients. I now have a resource to go to for our patients that I take care of on the home-based setting when people are aging in place and they can't get out to the physician anymore on a regular basis, and I send our physicians to their home. Now I have a resource, a trusted community resource to take care of those patients. And that value, you can't put a price on that value. We've all worked with insurance companies, we've all worked with everything like that, and just to call a number, to ask for a referral, to ask for someone to say, hey, we're going to send someone out, I'm confident that that someone will be this team here, especially for this close region. And I've already shared with all my contractual partners and insurance companies, Medicaid, MCOs, Medicare Advantage plans in the area, and we've got some introductions already set up and ready, because I want them to feel that here's a trusted resource in this community. They planted this seed, they planted this tree, and it's going to flourish. I know it is. So best of luck to you all. I'm just happy to see you guys be successful. Congratulations.
Alrighty. So for our last speaker, I think it would be really great to hear from a patient, or at least dad of a patient. And if we could call in Mr. Patrick Girvin.
Hi, my daughter got physical therapy from Day about a year ago, and you'll see there's good reason why she's not here this morning, because it was so successful. My daughter's a competitive gymnast, and when she met Day, she was 15 years old and level 8 gymnast. And if you don't know what that is, which I had no clue until I had a daughter who was a gymnast, that means that she's doing all sorts of crazy things on all sorts of different equipment, causing her body to go into all sorts of crazy positions, which most of us would pretty much end up in the hospital if we tried once. But anyway, she's doing pretty well, and she had been doing a number of things on the balance beam, which is, you know, a tall beam probably seen in the Olympics, and doing back handsprings onto the beam, and it caused a lot of hyperextension and a lot of difficulties. And so she had a lot of pain, and we initially went to an orthopedic surgeon to take a look at her, Dr. Lauerman in Georgetown, and they took x-rays and examined her, and it was pretty much just kind of, well, rest. Don't exacerbate it, which is very difficult for a gymnast to do. Because the whole reason kids go into gymnastics is because they're hyperactive. Which is true, Marcus. And after she'd been going for a while to Dr. Lauerman, we said, well, is there something else we can do? And I said, can we take her to a chiropractor? And he said, sure. So we took her to a chiropractor, and the guy worked on her and cracked a lot of things. And it really didn't do anything for Cecilia. I know it helps a lot of people with certain types of pain. And went back to Dr. Lauerman again. Now it's, this is an ongoing problem. And I said, can I take her to a physical therapist? He said, well, yes, of course. That would be a good idea. Okay. So at that time, I didn't really understand the differences of what a physical therapist can deliver and what a chiropractor can deliver and an orthopedic surgeon. I just assumed the surgeon would do everything. But it's not really that way. When Cecilia went, my daughter Cecilia, when she went to Day, the first thing Day did was do a very, very detailed, careful evaluation of her. And she was able to localize problems that neither the orthopedic surgeon nor and a sports specialist orthopedic surgeon nor the chiropractor were able to find, which was that in her lower lumbar region that you have all these joints between your vertebrae, that there was one joint that was stiff. She was able to measure it with her fingers and tell that there was one joint that was stiff that was making the other joints have to go too far. And that was causing the pain. So even though the pain was in the one that was going too far, the problem was a different one. So she gave some exercise and taught her how to do some more things, even more types of exercise, specialized that would help stabilize the core, and that allowed her to take some of the pressure off that joint. And the reason she's not here is because now she's a level 9 gymnast. Wow. She's busy, and we're happy, and she's doing much, much better. So, thank you, Dave. Really appreciate it.
So thank you for choosing to be with us instead of your daughter. Thank you. All right, they, in terms of our appreciation.
Whoa.
So we'll get started. I know it's early. We were planning initially that the kids go ahead and give it, but we don't want the cops to all of a sudden come here. So again, thank you for our speakers. Everything that you guys have shared, I know some of you, we only met now. And I think on behalf of the team, I think we're very touched with the things that you have shared. And you know, as you mentioned about the quality of whatever it is that we're doing here, but it goes both ways. The quality of people who are here, whether you spoke or you as a participant, we're very much honored that you guys are here. Thank you for that. So for the first speaker, Delegate Guzzone, so you know, in terms of helping local communities, so we have Bordy here, which is local here in Maryland. So yeah, thank you. All right, thank you for being here. I know we owe Delegate Turner one, but we'll make sure we'll give it to Dr. Lamb, if you could. I don't know if you're a red wine, white wine drinker, but feel free to exchange or whatever. we could easily make that work. Senator Kittleman.
Thank you very much.
Thank you as well. All right, Mr. Casey on.
Oh, sorry. It's okay, don't worry.
I'm just grabbing a bag here, Mr. Patrick Girvin. Yeah, not for Cecilia, not yet.
Not yet.
Once she reaches level 10, maybe.
Yeah.
All right. So, yes, I think I got everyone correct. Yes. Okay. So we'll go ahead and proceed with the ribbon cutting then.
Yeah.
And I think everybody could really join in. And
What do you want to do out here? Or you